Hello, and thank you very much for inviting us to speak today. It's going to be delightful to share what we're doing. So my name's Leek, and I run an organisation called Fruit Fly Collective, and predominantly most of our work is supporting families and children where the parent has cancer, but a lot of that also and other projects relate to translating difficult, complex, kind of scary clinical information into something more palatable and digestible and a lot more friendly, and especially child friendly. So this is?
I am Jackie McDermott. I'm a histopathologist at Imperial Healthcare Trust, and I've been working with, Royal Marsden Partners, which is West London Cancer Alliance. It covers a huge area from obviously North and South West London, and it covers about 3.8 million people actually, so it's a huge area. And this whole project really was born out of a discussion between Lindsay Farthing, who leads the early diagnosis programme at RMP, and Laura Tuckman, who's a medical oncologist at Imperial, who really were thinking about what kind of resources are needed for patients with Lynch syndrome, or for patients who are women who have just been newly diagnosed with endometrial cancer as well. And the things that were identified really by Laura in her practice and in her experience really is that she hosts, like many oncologists, if there are any oncologists here, very, very busy clinics. And as patients will know, the clinics are very, very busy, overrun, you're waiting there for a long period of time. You've got a very short period of time in which you can, as an oncologist, talk to the patient, answer questions and so on and so forth. And it's not very satisfactory. So what Laura really wanted was to discuss about developing resources that would help the healthcare professionals to give information to patients, but also information that patients can take away with them, which will help them and empower them to take control of their own treatment pathway. So these were the things that Laura was thinking about. So these two people kind of got together with, our S's have dropped off, with a number of people that we decided: pathologists, clinical nurse specialists, patient reps. Tracy's been involved with this, Laura has been involved with this, Anna as well, and oncologists, to get together really what we just came up with this name, Cancer Genetics Working Group, to think about what we could do, how we could provide this information to help healthcare professionals and patients at the same time. So we had a number of objectives. Before I wanted to come on to that, Caroline, I just wanted to say that all of the people in the Cancer Working Group are brilliant women. We've got nothing against men, but we couldn't find any brilliant men. So there's a plethora of brilliant women out there, and so it was quite easy to pick them. So if you are a brilliant man and you want to get involved, please just take my email afterwards. So what our objectives was to try to understand from patients really how people feel about being newly diagnosed with endometrial cancer. Do they feel like they got all the information that they needed? Did they understand what was going to happen to them? Did they understand why tests were being done and what those test results meant? Because it's very, very confusing. As a patient, it's very confusing, but as a healthcare professional, it's very confusing as well. It's a very long and winding pathway. Why are we doing MMR testing? What is MMR testing? What do the results mean? There's lots of different types of results, as you know. Do I need methylation tested? Does my tumour need methylation testing? Do I need to then go and see a clinical geneticist? It's bewildering. And so it's difficult for healthcare professionals to give that information. Sometimes they don't understand all that information, and it's difficult for patients, especially when you've just been given a diagnosis of cancer, your first diagnosis, which of course everything in your mind completely is emptied by that. So we wanted to create something that would help patients and also help healthcare professionals, especially in the context of busy clinics. How can we give all the information that we need to patients with that's effective, that they can take away with them and digest at a later stage? So we what was there another objective? Yes, that objective, of course, the most important objective, that we wanted to create something that wasn't blue and white. That wasn't like NHS, blue and white, and that you're like, right, well, I'll read that later, gather dust, put it in a drawer. We wanted to create something that was new and innovative and funky and colourful, and something that you think, yeah, I'll have a read of that. or even like your children might even want to have a read of it because it looks interesting and exciting, but it gives you all the information that you need, and also you can use it to then carry it with you throughout your treatment and management pathway and really understand what's happening to you, what's happening to your tumour, what are the questions that you want to ask. Are you getting the right treatment? Are you getting the right tests being done? So we needed to try and find somebody that was creative and funky and with it. And so we found her. Well, she's actually my sister, so it wasn't difficult to find. So, of course, I knew that Fruit Fly Collective had developed all sorts of fantastic tools in the past they're currently creating fantastic tools for patients with cancer. And so naturally we turned to Caroline.
So it was a very fantastic process because all of the fantastic women involved made it very easy. So we just created a draft. Bless you.
Thank you.
And then we sent out the first draft to everybody, so healthcare teams, patient representatives. Tracy, you sent it to your community just to make sure that the wording was fine, or the images, the graphics and all that kind of stuff. And then all the edits came back and we made the amendments and then we printed it, and that was basically it. Bless you. So you can have a look at the back. We brought some with us, and so this was it. This is the main leaflet that healthcare professionals would give to patients once they have been diagnosed with endometrial cancer. And then, so you can see here, helps with the results and the wording, and it's a bit colourful, as Jack said. And then there was a lot of information, obviously, so therefore we just thought we don't want to overwhelm the patients to begin with, and actually every patient will have a different pathway. So how do we kind of manage that? So we came up with the idea of having different, what we call appendices or bits of information, so each patient can kind of go along their pathway and curate and bespoke their own information that they want to collect.
So yes, it's bespoke. That's the word that we like. So it's a leaflet, but which you can put your own inserts in that are relevant to you and your tumour and your disease and your treatment pathway. So one of the things that we thought was really important was and you can see them all at the back or wherever they are, but the insert on my test results. Because that helps people understand what's happening, what tests are being done, why those tests are being done, and what the results of those tests mean. But also it means, have those tests actually been done? What are you still waiting for those tests? And if you haven't got the results of them, you've got to tell your oncologist to ring up me, people like me, histopathologists, and say, where are these test results? So it's a way of giving patients the power to say, this is what we need, what needs to be done for me. Why hasn't it been done? Or if it has been done, where are my results? What do my results mean? So it means that you can so you can fill in all these things. Which of my proteins are missing? Is it methylated? Do I need a referral to clinical genetics? When is the date of my appointment with the clinical geneticist? So it's a way of you taking control of your cancer, your treatment pathway, and putting pressure as well on the professionals to make sure that it's being done in a timely manner as well. There's all sorts of other inserts as well. That also there's the family tree insert. So it gives you a tool to be able to talk to your family as well about what's happening to you, and if you do have Lynch syndrome, what that means, what the implications are for your family as well. So hopefully it'll be helpful to lots of people. Yeah, so there's loads of them basically. You can see them all at the back. So what's the next one?
And then working with Laura, where are you? Oh, there. Sorry. We then adapted it obviously for colorectal cancer. So we just did the main patient information leaflet and then the test results there. So again, you can have a look. And Laura adapted all the bits and relevant bits and whatever, and that was quite easy for us to do. And then eventually, the last bit is just about what the future looks like for us.
Yeah, I mean, there's a few more things that we need to do. We want to make inserts for each of the MMR proteins that are lost so that people can understand what that means. Before I go on to number 2, this piece of work was funded by RMP, and it's going to be available. It'll be available for all healthcare professionals in West London, but also it will be, the PDFs will be available on the RMP website, so nationally they can be used, and Tracy's going to obviously have them from Lynch Syndrome UK, so they can be available for anybody that gets involved with the charity as well. So I mean, what we want to see is it rolled out nationally, so that they're fantastic, they're useful, and it's something that means that it empowers patients, which we think is really important. So we were so excited, and we had so many brilliant women. We thought, well, we've got a bit more money, so we thought, what else shall we do? And Caroline's Fruit Fly's forte really is providing resources and toolkits for patients who have been diagnosed with cancer, and how they talk to their family about that. So we thought this fits in really nicely with the work that we had been doing on Lynch syndrome and other cancer genetics, because obviously that's a huge part of what happens and what you're feeling when you're diagnosed with Lynch and other genetic syndromes as well, cancer syndromes as well. It's not only what's happening to you, but what does it mean for your children? What does it mean for your parents, for your brothers, for your sisters? And so we want to create a kit that can be used by people so that they can begin that conversation and help them to make those easier conversations.
Yeah, I'd just like to add to, so we'll be around for the next few hours or whatever. So if anyone's got any thoughts and ideas what they would like to see in a kit, because we're obviously at the developmental stage, so if you've got an idea, you think, this would have been really important for me, or really helpful for me to talk to my children or whatever and explain. At the back we've got some tools that we have in other kits, so just give you suggestions and ideas of what we generally do and lots of different things. But if you don't have any suggestions now and they come late at night or in the shower tomorrow morning, there's my card there that's got the email, so please just drop me an email or with Tracy, and we'll collate all those ideas. But thank you very much for listening to us, the duo.